my role at Success Rehabilitation is to provide clinical leadership for our team and also provide direct care service to persons with brain injuries, both acquired and traumatic brain injuries. So I do a little bit of talking to people who are the direct care providers of care, and I also do work directly with people who are going through many of the same things all of us are going through at this point, which is a certain degree of stress with social isolation, maybe more responsibilities, maybe too few responsibilities, and trying to help people through those challenges along the way, as well as dealing with my own kind of stress level as an individual, as a human being these days. So that's what I do. So the cognitive issues that every individual has here, to a greater or lesser degree, affect how they understand what's going on in terms of the virus and the implications of the virus in our lives. So I'll give you a good example. An example would be an individual who does not understand or cannot retain and remember that social distancing is important, use of masks is important. Those individuals need to be cued continuously, many times within an hour, many times over the course of the day. They need to be cued about that they need to wear their mask, and they need to be cued about keeping their distance socially. So those kinds of things, understanding the behavioral restrictions, and then also understanding why it is that they can't go and visit their loved ones. They don't necessarily understand why is it that they can't get back to their jobs or their volunteer activities, or their quality of life issues. Like we have residents here who attend book group. Or who go to yoga in the community. They can't do those things because of everything that's going on. So it's just like kind of coming back to it, repeating it, helping them understand the details. So there's that piece. And then there is the piece that interfaces really with the cognitive piece, and that is having to do with their level of anxiety. So, people who have acquired and traumatic brain injuries, just like all of us, are watching the news, and we're hearing a lot of things, and they're going on the internet, and they're reading a lot of scary details, and they become flooded and overwhelmed. What does this mean for me? What does this mean for my loved ones? What does this mean for my 94-year-old mother, for instance? And so they are scared. They're scared of when they hear things, rumors happening. So that in turn makes them more confused sometimes than they would be in a regular basis. So an example would be if somebody is knows and understands that his job is not kind of an option right now because of COVID. So he can't go out and work. He can't go into his job as a retail person who he was maybe working as a cashier. So he's understanding that. So we kind of established that he understands that. And everybody in the team is talking to him. His residential person is talking to him. His case manager is talking to him. His therapist is talking to him. We're all kind of saying the same message. Right now, stores are closed. Right now, his job isn't even kind of open right now. So he understands that. But then he perhaps watches a news program, and he sees the protests, and he sees the demands to open businesses, or he sees that, and then he sees also that there's maybe an increase in cases with the reopening of the state, the gradual reopening of the state. And then he hears yellow zone. He thinks, why does that not mean that I'm going back? And then he gets anxious and overwhelmed and maybe angry. And so that's the irritability factor, and that kind of kind of combines with the social isolation of not being able to go out the way that he previously did. So it's kind of all of these pieces on top that all of us are dealing with, that the clients are managing. So what that means on a day-to-day basis is a lot of reminders, a lot of allowing somebody to vent about their frustrations and vent about what they see and hear and how that what that means for them. And then it means a lot of coming back to kind of saying, this is reality. This is just how things are. A lot of people, want to blame somebody, want to say, oh, it's the state, or it's, maybe kind of thinking about whose fault this is. And that's just not always possible to have those answers, and just dealing with those unknowns and the frustrations.